Hi everyone, I am Dr. Rajajinagar, specialist in high-risk obstetrics, gynec and fertility specialist. I am medical director of Thanisandra Hospital and I do overseas consultation with medical tourism. I have worked overseas also in the same specialty. This question is very tricky. What is the cause for failure in IVF? This could be male factor or a female factor or a lab factor. So when coming to a woman who has got medical comorbidities or associated with PCOS, which is very common, that is round about 25% of IVF patients have PCO, where the androgen, the male hormone predominates. When the male hormone predominates, the quality of the egg will be poor. When the quality is poor, the fertilization is poor. And when the fertilization is poor, in the lab, the cleavage rates will be altered, fragmentation occurs, and when the embryo is poor, it cannot stick into the womb. And coming to the other conditions like fibroids. The fibroids is a common condition where the woman faces difficulty to conceive, but natural conception can occur. But if a woman fails, especially if it is the uterus, if it is a polyp or if it is a intracavitary pedunculated fibroid, or it is the fibroid indenting, giving distortion to the uterine cavity, it can cause poor implantation and the success will be poor. So we need to optimize it by hysteroscopic resection or by laparoscopic resection of the fibroids. Now coming to the endometriosis, here the egg quality is very poor. So we need to assess the woman whether she is grade 1, grade 2, grade 3 and grade 4. Grade 3 and grade 4 gives poor results. So at that time we need to go for donor. This may be an important cause and may not easy to accept by the client. Then the other causes can be like tube factors, but it gives a good results. The infection, the uterine cavity abnormality like presence of septum can give rise to poor IVF success. When there is a poor IVF success, then we need to look for the alternative. I won't complain only of the patient, even the IVF lab is very important. In the IVF lab, there should be good air compression and there should be an individualized incubator for each patient, and the culture media plays a pivot role. Hence, the IVF success circuits between the patient preparation, the lab and the expertise and the protocol customized for the client. So, please you need to check before you go ahead. That is my piece of advice to all of you.